Okay, we'll log them.
Okay. Thank you. We are calling this meeting to order and acknowledging that we are on the traditional territory of the Lillooet people here in Pemberton. And could I have someone move approval of the agenda? Moved by Director Richmond, second by Director Stoner. Any opposed? Motion carries. We do not have Darlene McKinnon joining us. We have Amina Diversovic, community engagement.
Look safe. Wearing a seatbelt.
All right.
Good afternoon, everyone.
Hello. We're just waiting for one more of your team members to join us.
Who else are you waiting for?
Amina.
Oh, Amina's here. Amina, are you able to hear us?
Okay, so she's just stuck in Zoom land right now.
Okay.
There we are. All right. Okay, welcome to you three. I will yeah, I'm going to turn the floor over to you. You can introduce yourselves and tell us what you're here to say. Thank you for being here.
Thank you for having us. Is someone able to share our slide deck for us, please?
Yep.
Okay, thank you very much. Okay, so good afternoon, everyone. My name is Belinda Graham, and I'm the Acting Executive Director for the Planning and Projects team at VCH. I have with me today my team. Alan Nicholson is the Project Director, and he'll be leading the Sea to Sky Master Plan for us. We also have Amina, and Alan unfortunately is commuting. We had to pull him in last minute, so appreciate that he was able to come in. Thank you for supporting us. We also have Amina Jervisovic, who is the manager for community engagement. Next slide, please. Oh, can you go to the land? Yeah, acknowledgement, thank you. So I just want to do a quick land acknowledgement. We are grateful to be here today, and we want to acknowledge that the VCH Health Vision Sea to Sky engagement is taking place on the traditional and unceded territories of the Squamish, Lillooet, Nakwakwa, Chamakwan, Scotty, and Hawkshaw nations. And we are really grateful to be here today, and thank you for having us. Next slide, please. So today we are talking to you about the Sea to Sky Master Plan, and just a little bit of background and understanding of the context. We understand that the communities in the Sea to Sky region is rapidly growing. And we also understand we have 6 First Nation communities, and they're all very unique, and they all have unique healthcare needs, and they're all living in this region that have that we want to be able to address their needs. We also understand that the data is pointing towards a rapid growth in this corridor, with more and more young families coming into the corridor as well. And we also understand these communities have an influx of transient visitors in the region. And all of this contributes to a higher use of healthcare services. Importantly, we also acknowledge that the clinical services currently offered is out of date, and we need to address that by doing this Sea to Sky Master Plan so that we can address the future demand for clinical services in this region. And this project will be able to we'll walk through the process and how we develop that. Next slide, please. I'd like to pass it to Alan to walk us through some of the data.
Sure. Thanks, Belinda. Can everyone hear me okay?
Yep.
Yep, great. Okay, so I just want to frame the project as we've sort of got it set up so far. what you're seeing in front of you right now is the extent on the left-hand side. That's the extent of sort of Vancouver Coastal Health's jurisdiction. And on the right-hand side, the green area, that's the sea to sky area specifically. And so that's the area that we're concerned about. We're not looking at any of the other areas within Vancouver Coastal for the scope of this master plan, although we are coordinating with some of the other efforts, specifically with the North Shore, because there's such a direct tie to the health services there. And so then within that region, which is called the Howe Sound region, we've got three major centers. We've got Squamish, we've got Whistler, we've got Pemberton. And they're all very different and very unique, and you know them better than we do right now. But we're learning very quickly all the intricacies of the health services offered in those areas currently, and what we should anticipate in these areas in the future, given the population projections. And so maybe if we slip to the next slide, that'll articulate some of that a little bit. So how are we growing? So this data we gleaned from the province. And we're also going to be reviewing with each of the specific municipalities the data that they have for their planning as part of our engagement coming up. But at a high level, this generally shows you the areas that are growing, and I won't get into too much of the details. I'll just talk on the totals. You can see, currently we've got 44,000 in the area as of the latest census data. In 2030, so only 7 years from now, we're 53,000, and then in 2040, 62,000. So roughly, within span of 17 years from now, we are increasing the population by at least 50%. So that's and one thing that's not shown here is the demographics that are being increased over the age of 19. We have a bit more breakdown that's coming in those areas, and a lot of it is in the working. Sort of, I'll call it 30 to 45 age category, but also there's a fair amount of seniors that are increasing. Their population is expected to double. Now it's a smaller population, but it's a much higher user of health services. So we have a lot of work to do to make sure that we can create a master plan that's going to be it's going to take into account the growth challenges that we're anticipating over the next couple of decades. Next slide, please. So this is just a quick overview of the clinical service facilities that we're going to be looking at. We have already been through the facilities at a very high level to understand them, visualize where they're at right now, get some feedback from staff. But it's been a very cursory sort of catch our bearings kind of a start. The full engagement hasn't yet started. That's we'll talk a little bit about that later on. But in general, these are the facilities we're focusing on. So we have those 5 in Squamish, anchored by Squamish General Hospital, and then we have the Whistler Medical Clinic and the Pemberton Health Clinic, both of which have the community health centers contained within. Next slide. So planning for the future. So in addition to looking at where we're at today and what the facilities can handle and the service planning that's done right now, we want to grow with the population as we've articulated. We want to make sure that we maintain access to safe and high quality healthcare. Now that doesn't mean necessarily safe in terms of physical security. I mean, it does, but it's more than that. It's about welcoming spaces where people want to come and feel good about the healthcare that they can receive. And the healthcare models of the past don't necessarily offer that to all communities. And so we're investigating that as a part of our work. We're looking at the master plan for the next 5, 10, and beyond into what's going to be needed. And we're starting by not making any assumptions around facilities. We're starting with the needs and sort of assessing where we're at and what the vision is today. And then we'll get into facilities as a later part of our exercise. First Nations, municipalities, regional hospital districts, BCH staff, politicians, and the community, pretty much everybody we've talked to is very much in support of getting this master plan done. In fact, the feedback we get is how come we're not going faster, or how come we haven't started yet? And that answer is in the 4th bullet there. In fact, it was started in 2019, but then the pandemic came, and as we all know, the health authorities have been very stretched in dealing with that. So this initiative was put on hold while we focused on more urgent needs at the time. But now it's, in the past 6 months, we've talked to the ministry, we've got approvals to pick this back up and get moving. And so here we are now getting it moving. Next slide, please. Belinda, do you want to cover this?
Sure. Thank you, Alan. So can I get you to put yourself on mute for a second? Thank you, Alan. We met again with the VCH senior executive team back in January when we relaunched this project, and we wanted to realign our vision and our objectives to achieve. So the senior executive team came up with these 5 bullets that you see here. The first one and foremost is that we want this project objectifies to be respectful and unique needs of the rights of Indigenous people and culturally safe healthcare and services. So that is one of our pillars of this project. The second bullet is that we understand the changing and specific health needs of Sea to Sky communities. And Alan and I alluded to it earlier about the data projections, more and more young families, the visitors that's coming in, the growing population. We understand it's changing, and current clinical service plan is not addressing those needs. The third bullet is the project will develop plans to address the forecasted healthcare capacity increases. So this is alluding to the facilities side as well as the clinical servicing planning. We know the healthcare capacity is not where it should be to service into the future. So this develops what does the facilities will look like for 5, 10 and beyond. And the fourth bullet is we will maintain access to safe, high quality healthcare. That is one of our pillars. And the last one is to enhance integration of health services across the region with the North Shore and Lionsgate Hospital. So we need to look at it from an integration high level, as well as each site will also get this master plan as well. But how does that look, and how does it impact the North Shore and Lionsgate Hospital? That we will be working on towards as well. Next slide, please. Okay, Alan is going to speak to us about the engagement and perhaps some of the processes.
So a normal master plan project where you're just sort of looking at one site would have a significant amount of engagement, but it would also have a significant amount of technical assessment of facilities. And we do have that, but I guess the nuance to this master plan is we're not just one facility, we're 9 sort of individual either facilities or spaces within facilities. And we're across a wide number of communities. And there's a large volume of engagement that we need to do. And so we have got a team from Vancouver Coastal, community engagement team that is very focused on that. And that's being led by Amina, who's on the call. And unfortunately, Amina's ill. She's got a raspy voice today, so she asked me to speak on her behalf. But she's very capable of leading us. I've really been pleased to work with her so far. And she and her team, which includes specialists that they've engaged in a company called Happy Cities, which is a specialist in public communications and engagement, as well as a group called Firelight, which is a First Nations engagement specialist. So it's quite a robust team that we've assembled to go and do community outreach. And there's a few phases to this. The first phase, as I mentioned before, is really about our current state and the current vision ideas that are within Vancouver Coastal, within the community, within this group. This is all the information that we want to hear. And we want to, we're trying a variety of ways to get this. One, we are preparing a survey, which will be issued, anyone and everyone can participate in, and that'll be issued in a few weeks. And we're also reaching out to our key partners, which certainly includes this group. And we are sending out letters, which one will be issued shortly, requesting time for engagement, consultation, some feedback on who should be involved from your side. And it's part of our phase 1. We really want to just open the doors and open our ears. And then there's a couple of phases, and you'll see this sort of laid out in the timeline and a few slides later. But phase 2 and phase 3, which really are about now that we've heard all the feedback and we've collected all the data and we've started to throw this all into the digester and let it simmer and cook for a little bit, we're going to come up with some ideas. and on how we can address the challenges that we're being faced. And then we're going to want feedback loops with each of the groups. So we're going to come back to you in those phases and say, here's what we heard. Here's some of the concepts we're developing. What do you think? And then there's a phase 3, which will have even more granular detail in terms of how we're going to be addressing these solutions. And at the end of this process, what we hope to have is a menu of options for clinical service changes or increases or decreases or whatever it might make sense, as well as infrastructure changes, which would be a menu that we can then prioritize and start discussing with the ministry of how we want to implement this. And that menu is ideally something that we have all of our key partners behind saying, yes, this makes sense. We agree with this. And so, yeah, that's generally the concept around the engagement. It's going to be a very holistic engagement process. Next slide, please. So this just, I guess, just a little more detail on what I just spoke about. So we don't have to go over this. Final slide. So these are the timelines. So you can see phase 1 is roughly May to September. When we've got the survey, we start the engagement with our key partners, and we also do some engagement with the VCH staff. Lots of very detailed discussions around the clinical service planning that they do right now and where the gaps are. Phase 2 is going to begin in the fall. We've got 3 months there to do a feedback loop and come up with some, discussion around our early ideas and how they resonate back with the key stakeholders. And then phase 3 is beginning in next year, where we start to put master plans down in paper on, okay, well, if we heard that we need more service in XYZ department, how about we look at creating more space for that department, and where would it go? How would we restructure the facility to accommodate that? And then over the next summer, 2024, we hope to ratify it all and then come up with a report that will be issued to the public in the fall of 2024, so that everyone in the region sort of has an idea of where we're going. And yeah, so that's the plan. Next slide. I think that was the last slide, right? Yeah, that's the last slide. So I guess, Belinda, do you have any closing comments, or do you want to open it up for questions or discussion?
Yeah, we just wanted to acknowledge that meeting over the summer is going to be challenging. So we've been told to do this right and not try to just hurry up and get it done. We want to make sure that we are engaging properly. And that's why we do have a robust team in place, so that we have our checks with the communities and our partners. And you guys being one of them, our key partners, to be engaged. So we just started phase 1, and coming to this today is our first step is just to give you guys an update on what's to come. Any questions?
All summer long, so we're happy to be engaged with this process over the summer. We don't get the summer off, so we keep working, and I know that you do too. And so let's stay. We don't want to hold you up. We will be available. I have Director Richmond and Director Crompton and a whole bunch. I have everyone. Oh, yeah.
Okay.
Go.
Thanks to the 3 of you for being here. I think I could safely speak for all of this table and say we have been very, very, very anxious for this process to start. Sea to Sky region is, as you pointed out, growing very rapidly, and I think our needs have changed. And the amount of travelers we get through here skews our numbers huge. So there's a lot of really good reasons that this is timely. I'm going to pause. Sorry, there's just a truck pulling out for a second there. Thanks. So very we're very happy that you're here. We're happy that this has finally gotten started, and we have a lot to put into it. I think it's safe to say too that this group very much appreciates and acknowledges the fact that we have health care needs as a group, as a region, that need to be looked at regionally. And we have communities within that region that bring special needs and have different cases. So we don't necessarily have to go back to the slide, but just a couple things that I'd like to point out. First, in your data projections, you point out the populations of Squamish, Whistler, and the growth. and then you've incorporated Pemberton in rural Howe Sound. To me, that's my alarm bell just went off. Pemberton is not part of the Howe Sound rural area. It shows the population at 7,800 with Howe Sound rural. We're close to 10,000 now in 2023, just with the Village of Pemberton, Area C and Leeward Nation. That doesn't include the fact that we service the Lake Nations and the Quaqua and other regions as well. So the fact that Pemberton was lumped in with Howe Sound rural in those numbers, to me, and maybe that's just a single stat, but it right away raises alarm bells for me that it is being lumped in and considered. It is not being considered on its own. Again, back to my original comment, we consider everything as a region here, and we want to make sure healthcare needs. There's definitely some services better placed in Worcester, in Squamish. There's some services that we will definitely have to go down to Lionsgate for. We know that, but we want to make sure that we're providing the best service within the whole region. And again, just looking at that data there is worrisome to me that Pemberton is just being lumped in with Howe Sound rural. And the second comment I just want to make is around your engagement piece. And hopefully you've considered this. I just have some small concerns around engagement with mental health providers, in that the mental health services are less centralized in terms of how they're provided. You know, for sure there's things being provided through clinics and healthcare centers and that, but a lot of mental health services are being provided through private providers. And so I just want to make sure that part of your engagement plan, you know, captures some of those private providers and their input. Thank you.
Alan, did you want to respond to that comment?
Yes, please. Thank you for that. Very astute observation, Director Richmond. We noticed the same thing with Pemberton being lumped into Howe Sound rural, and we already requested that data to be adjusted so that we have separate data for that municipality that is not lumped into the rural, because it doesn't make sense to do that. It actually skews the data in a way that would give us poor results. So we have a whole department around decision support that received new data in November of 2022, and they've been working through it. And so it's fully our intent to have that separated the way that we are separating, or then the diagram shows Whistler and Squamish is separated already. We will also have Pemberton separated. So we'll have 4 data sets effectively as we start to move forward. Does that answer your question?
It does. I appreciate that. Again, we're on the northern end of the corridor, so we service all, you know, vehicular accidents and all that going north to the Duffy, all that sort of thing. So
yeah,
I'm glad that you're considering it.
And when we were up there talking with the staff, what we learned was is on a tangent maybe, but anecdotally, the service for a lot of the smaller communities and the First Nations, it extends a very far ways across, to the point where some people are driving 2 or 3 hours to get to the medical clinic for a simple little test, and then 2 or 3 hours back. So there's some, it was clear as day that we need to relook at some of the service modeling up there. So yeah. And then the other question around the engagement, Amina, if you're on the call, do you want to respond to the private mental health providers, service providers?
Absolutely. There will absolutely be an opportunity for private mental health service providers to provide input as part of both the survey in the phase 1, and then community conversations in phase 2, and then site master plan engagement. So when we're looking at individual sites, so in all 3 phases, there will absolutely be an opportunity for everyone to provide input. And in addition to that, if there's anyone in particular that you have in mind, I think it's really important to keep them updated and to share all of the opportunities with them, or to let us know, and then we can absolutely get them involved as early as possible.
Yep. Director Crompton.
Thanks for the presentation. I'm interested in the objective of enhancing integration with Lionsgate and the North Shore. I'm grateful that you put that right up front for us. Is it fair to say that enhanced integration suggests increased integration?
That's a great question. It's complex. I think it's hard to broad brush that. There are some areas where we're going to be, it's too soon to say solutions at this point because we're just in the initial phases. But some of the concepts that we'll be evaluating are decentralization, specialization, and enhanced transit means so that things that flow between different medical centers are done more quickly or more efficiently or with resiliency, so that if there's a problem on the highway, it's not an issue. So all of this stuff plays into what we're going to be looking at, and so I don't think it's just one way. It's going to depend on what aspect of the health service we're looking at makes the most sense. Does that make sense?
It does, and I heard you say that it's too early and that you're in information collection mode, but I have to assume that there are some assumptions that are being made going into this. So I wonder if you've been given any direction from VCH executive related to any services they perceive as provided by areas outside our direct region. There have to be some that are sort of, we're not setting up cardiology in Whistler. And so I'm just wondering what assumptions are made about where services will be integrated with the North Shore and where they'll be more regional in nature.
Maybe this would be a good time, Belinda, to talk about the CT scanner.
So let me just address that first comment. We only had a kickoff meeting as well for our project delivery team, which is made up of the operations directors and operations managers and local medical directors and department heads from the sit in Lionsgate that look after on a regional approach. So we only had only one kickoff meeting, and that was only 2 weeks ago. So when we say it's too soon, it's because we haven't really even engaged the deep dive of phase 1 yet of getting to know what the clinical service plan will look like and understanding and assumptions. So we don't want to promise and we don't want to under deliver, but it is really too soon because we haven't really sat down with these clinical leaders into discussing which services will remain and which one will be separated. And to talk about the CT scanner, there are other initiatives that will move ahead of the Sea to Sky master plan. It has been supported by our board chair that the CT scanner for Squamish, for example, is happening sooner than Sea to Sky master plan, this project.
Great. I would just say, I think it would be through this process, the putting those assumptions into the world would be helpful, because I think what you'll hear from us is we want a hospital in Pemberton and we want a hospital in Whistler and we want a hospital in Squamish. And I think as it becomes clearer, what integration will likely mean and the assumptions that VCH is bringing to the table, us understanding that through this process is good. I very much appreciate the intention to be open-minded and to hear the input of our region, but if our input is unrealistic and just is not going to happen, I think it would be important for those assumptions to come to the surface as early as possible.
Absolutely. And if I can just add to that, what we're hearing is that continuity of care is really important, and ensuring there is continuity of care for patients and families across the corridor. But in terms of phase 2 engagement, this is why we're having community conversations once the clinical planners have heard all of the input from clinical staff and have looked at all of the analysis and have some, as you say, options, best options considered. So some things that are going to be considered in phase 2, and this is when we have more in-person events for community conversations. So the first phase is more visioning. The second phase is looking at what the planners have put in place for us.
Just finish up by saying that's great, because I think what Alan said is so important to acknowledge that, some of this is not what you would commonly think of as healthcare. It's transportation related. And if we start planning just related to the healthcare services that we want access to, we won't be sort of taking the full picture into account. And what's happened to this point is that communities have had to just, you know, with tape and baling wire, put together transportation solutions to deal with the reality that the services are not accessible to the people who live in rural Pemberton or down the Lakes Road. And so the fact that this plan could actually engage with transportation in a serious way, I think would be a real positive. I'm excited about this work and grateful that you took the time.
Thank you. Director Pettengill, and then I have Director Rainbow, then Director Stoner.
Yeah, two things, and just on the topic of assumptions, and I suppose it's a little bit anecdotal at this point, but I just want to flag it that in a lot of the presumptions discussion I hear, it's concern about people in our region having to go to Lionsgate and so on for complete care or for pieces of care. But I'm hearing anecdotally, because of things that are happening at Lionsgate, sometimes we are seeing the traffic flow the other way, and that's putting pressures. And so as we're looking at this, I hope we're sort of being open to the idea that it's not just us impacting Lionsgate. Lionsgate is impacting us apparently. So making sure we're looking at that. The other piece in the list of clinical services, I didn't see some of our community clinics. I'm not sure if that's the right term, but the Squamish-Lillooet clinic saw a really neat presentation from Chair Ford at the LMLGA about something that's happening in Whistler. So where do those clinics fall into this, and infrastructure and, you know, equipment that might go into those clinics? Where does that come into this discussion, or is that part of a separate discussion?
Sorry, I didn't catch which clinics you're asking about.
Primary care.
Primary care. Private
Oh,
primary
okay.
clinics.
Yeah.
Okay.
Nikki, do you want to address this one, Mina?
Yeah, absolutely. Engagement with primary care providers is extremely important part of this work. Looking at streamlining work and then also how we work together, extremely important. So primary care providers are being engaged at every single step of the engagement process.
Thank you. Director Rainbow.
Yeah, I've worked in the BC education system for over 40 years, and one of the things that I've observed there is that the Ministry of Education was always playing catch up with building schools. You know, they'd have a new development going in with 1,500 homes, and they would not build a school until the kids showed up. And you knew if they're building the homes, you knew the kids were going to come, and they did. So with that in mind, I kind of look at the population predictions that you have. So let's look at the rural. You predicted that, you know, 7,800 to go up to 8,800 up by 2030. That's totally unrealistic. You can expect 250 people in Britannia Beach in the next year. The homes that they're almost complete and they're almost sold out. So there's 25% you've got predicted increase already. We just several months ago approved a development of 1,000 homes in Furry Creek. We've got somebody come to the board next week asking for 1,000 homes in South Britannia. The people that own Porto Road are closely watching what happens in Furry Creek and Britannia, and I'm pretty sure it's at least 1,000 units there as well. So that's going to blow that number of 8,800 right out of the water, and that's just that little bit of the rural areas. I don't know what the municipal people think about the predictions for their areas, but it worries me that we're going to base decisions on numbers which are they're just unrealistic. And my question to you would be: were you aware that this board has approved those developments? So do you watch what is happening with development in this area, and do you factor that in? I think we should. We should. And the other comment I had was I was listening to what you were saying about community engagement and talking about community partners, and it seemed to me that we this group the hospital district board was being treated as a community partner. I think we're more than that. And I think you should look at us as being a little more important than just a community partner. And if you want to look at the group of people that can make decisions about taxation, about financing some of the work that we need to do, we're that group. So we're not just on a par with other community groups. And I think that you need to recognize that and treat us accordingly. Okay, thank you.
Good, Alan.
Thank you. Excellent comments. Thank you very much. The population data projections are just projections. I think there is like no projection is actually going to be right at the end of the day. And so we recognize this. We got some anecdotal feedback from our site visits that our projections were insufficient. And we're listening to that. It's the trick is for us, the fundamental data there is coming direct from the province. And so we're a bit hamstrung with those assumptions. However, I don't think it will have a material impact. And let me explain why. Because what we're planning on doing is creating a tremendous amount of flexibility in the master plan and aligning the menu of options, not just on a time basis, but also on a population basis. So if in fact the population doubles in 5 years instead of 10, our master plan still applies. It just needs to be implemented twice as fast. And so I think, you know, those kind of, if we build it that way, inherent in the overarching plan, and we have that flexibility, then the roadmap is still good. And then when we go to the ministry to get approvals for different projects, we just simply take the metrics of the day and whatever the forecast is for the next year or two, which is a lot more accurate than a forecast for 10 or 15 years out. So that's sort of one of the general principles we've been thinking of, because I mean, like I said, they are just projections. The ones that we have on paper there are not going to be right. And so we need to plan for flexibility. So before we go on to the next part, which is the sort of the importance of the SLRD, which I'll actually let Amina respond to that because we had some good discussion on that before. But does that answer your question on the first point, Director?
Sure. Thank you.
Okay, Amina.
Yeah, thank you so much for those comments. I just wanted to say that in addition to what Alan has shared, as part of the phase 1, we're also planning an engagement with municipal planners so that we hear from them directly what they're seeing, what kind of trends they're seeing, what they're preparing for, and what they're expecting, so that we can align with that. And that brings me to my question to you. The invitation letter to the phase 1 engagement has gone out today, so you probably received it. And my question to you is, when we're organizing an engagement session with Sea to Sky Regional Hospital District, would your recommendation be to also include planners in that engagement session? And I completely agree about the importance of this group. We just don't have, in terms of the engagement terminology, we have nothing above community partners. We have stakeholders, we have clients, families, community members. Partners are really our most important stakeholders. So if you have another term, please do recommend it. We'll gladly include it.
Yeah, hospital district.
And yes, we'll include our staff contingent that makes sense for that meeting, because it obviously we have the information that you need. So thank you, Director Stoner.
Yeah, thank you. Through the chair, I just wanted to echo my colleagues' comments about how there has been a lot of anticipation for this process to kick off. As you mentioned, it was a long time ago that we first started talking about it. So it's great to see that it's underway, and thanks for coming so early in the process to give us an update that this is happening and the timeline that you're working through. Just a few things that I wanted to reiterate, just at a high level, given where we're at in the process. to reiterate the comment that really, I think what I continue to hear from our communities is the importance of being able to access healthcare services in community or within the region. And we really see Squamish as being the southern anchor point to that. So recognize, as Director Crompton had mentioned, there will be some services we just won't be able to get through the Sea to Sky. But really, as much as we can, we want to be able to keep people in community. And a huge piece of that is that there is a lack of transportation in public transit in particular. And we hear this, especially from more vulnerable and low income communities who actually have a really hard time accessing services, especially when they're sent down to somewhere like Lionsgate, because there is no regional transit service in the corridor. And then I just wanted to expand a little bit. It's great to see that the master planning process is going to cover both clinical services as well as healthcare facilities. But I'm curious, without potentially risk of huge amount of scope creep, what sort of consideration will be given to support infrastructure, in particular housing for healthcare professionals, because we know that's a huge piece to actually being able to deliver the clinical services. And we hear about it all the time in community, as well as ambulatory services and the impact that actual movement of our ambulances and movement of patients has on our ability to deliver ambulance services. So just curious on those particular two pieces, if there's any opportunity to integrate them into this process.
Yeah, I can respond a little bit to that. It's funny, as we start to get into this, where do you stop? We could talk about food. We could talk about the quality of groceries that are available. It could go down a very deep wormhole because healthcare is so integrated into everything. Now that said, that's a bit of a stretch. We will not be talking about the quality of food in the region. That's a completely separate government organization that handles that. But housing is a very real problem for our staff, and we cannot. In some areas they have no issue, but in some areas they definitely do. And so I think we need to, as part of our plan, and we are planning on doing this, having a real estate strategy that not only is about the real estate of the facility that we are potentially expanding, but it also is what about a real estate plan that would support staff housing concept? Pemberton actually already does this ad hoc on their own with a small unit that some staff can rent. So there's some precedents that it's in play already, and we will have some commentary on that. I don't think we'll have a very detailed roadmap solution to it, but I think we will have some concepts put out there and some recommendations on how we should be looking at a business case towards some of that stuff for future consideration. And then maybe Belinda, you want to cover the ambulatory concept?
Let me just add to that comment. We understand when we presented this to the senior leadership team, they asked us to also address enablers. And so housing is an enabler, because how can we expand the hospital and have all these wonderful people served, but not enough healthcare workers to work? So that is also a challenge. An enabler, in order to enable this master plan, we need XYZ processes in place to support that. So while this master plan may not solve every problem, we will be able to at least mention it and say this, in order for this to happen, we need these enablers to also be in place. So that is something that has already been flagged by our senior leadership team. And we are aware that the challenges of housing is a very real problem, and it's causing a strain on the health system. Sorry, Director, can you repeat your question about the ambulance services? Is it the regional?
Just as we consider, I guess, integration into Lionsgate, the impact that has on our ambulatory services, because it does tend to, once we have an ambulance down in the city, we don't tend to get it back. And so just how we start to think about the impact on some of the other services, healthcare services like ambulance, when we talk about integration into the Lower Mainland.
Amina, can you remind me if BC Ambulance EHSF is also part of our partner engagement stakeholders? Yeah.
Yes, absolutely. Clinical services planning will be reaching out to them and seeing what needs there are and how that integrates with the services that we provide. Absolutely. It's a really important part of the engagement.
Thank you.
I would
Thank-
say, just to add on to that, we're not limiting it to that either. Like there's a lot of other enablers, like the housekeeping contractors, the laundry services, like the list goes on and on of what healthcare needs to run. And so each of those groups, we have a very long list of, I want to say almost 100 separate groups that we need to reach out to and meet with and listen to what their concerns are today, and then also follow up with in terms of where we want to go and what it makes sense. So.
Okay. Well, I think everything has been said to this point as far as how excited we are to participate with this, how available we will all make ourselves to be a part of this. Engage with us as much as you possibly can, because we've been banging on this drum for at least the last 5 years that I know of. And so we are here at your disposal. With that, I will thank you three for being here with us today, and we will see you again very soon.
Thank you very much. Really appreciate your time.
Thank you. Bye.
Thank you.
Can I have someone move that we close this meeting to the public, please? Stoner, seconded by Director Richmond. Any opposed? Motion carries. Yeah.